viewers, a good day to you. I am Dr. Sunayana, a passionate dentist by profession. Today we will see how to maintain our oral hygiene and the importance of a good oral hygiene. The lockdown would have seen with two different aspects in life. In one aspect, we wouldn't have eaten a lot of refined food or outside food or bakery products. And there would be another bunch of people who would somehow hunt all this on the YouTube and try to make it at home. And upon making this, we would have, sort of binge eating on all of this. And all this would have deteriorated our oral hygiene over a period of time. Today we will discuss about what are the substances that are good for the teeth and what are the substances that are bad for the teeth. Now, things that are good for the teeth are, number one is fibrous foods. A lot of us should consume most amount of fibrous foods. Fibrous foods are found in fruits and vegetables. Fruits include pear, vegetables include carrot, beetroot, cucumber. All this should be consumed after every meal because they are self-cleansable and they clean the entire surfaces of your teeth. Number two is cheese. A lot of kids love cheese. Cheese has an excellent anti-carcinogenic ability. So for kids, I would suggest that all the mothers give them a piece of cheese at the end of every meal. Number three being foods rich in calcium and phosphorus. Now this would be found in milk and milk products, meat, egg, and in green leafy vegetables. So we should make sure that we consume enough of them. And last but not the least, water. Water self-cleanses all the greasy areas and the blocked areas of the teeth, removes all the impurities that are being stuck onto the tooth surface. Now foods that we should avoid, especially for children, are sugary food. Any sugar, hard sugar candies, chewing gums, any sticky food substance should be avoided. We should also not give them bakery products. Bakery products should be given the least for children. It is not good for the general health as well as for the oral health. They stick onto the tooth surface and they are the biggest enemy for the tooth. The bakery products include biscuits, they include cakes, they include pastries. Anything that is basically sticky should be avoided. With increase in the refinement of the food, a lot of junk food is available. A lot of children consume food like pizzas, burgers, bakery products which are not good for the health and they should be discouraged. Instead, give them more amount of fruits and veggies. Incorporate more of this right from young age so that the child will get the hang of eating it. Today we are going to discuss what are the common problems that we encounter, common dental problems that we encounter. One that we encounter is dental decay or dental caries that we call it. Now, how does this dental decay or the dental caries occur? It is basically when we eat any food substrate, mainly which is refined in nature or sticky in nature, like your cakes, pastries, your colas and all of that have a lot of high sugar content in them. They basically stick on to the rough surfaces of the teeth and upon it the microorganisms are going to act and they will cause acid production and slowly eat up your teeth. Now, a lot of us will have certain black spots, but those black spots will not give us any sort of a trouble. Over a period of time only, we will find that we are having some sort of a discomfort. Why does that occur? Because the tooth is made up of three layers. One is the enamel, the dentine, and the third layer is called as the pulp. When the decay reaches the enamel or the dentine, which is basically the hard substance of the tooth, nothing happens to you per se. When it reaches the dentine, you might experience some sort of a sensitivity when you eat hot and cold food. But when it reaches the pulp, that is when you are going to have a throbbing pain. Now, what do we have to understand here is, caries that reach the dentine or the enamel can be repaired by simple fillings. But when it reaches the pulp, we cannot do a simple filling. That's when a lot of us visit the dentist because we do not get enough sleep, When we lie down, we have a lot of pain, or when we eat, we have a lot of pain. There is pain throughout the day despite of taking medications. So that is when we visit the dentist, and then we tell them that, please try to do a normal filling, or try to, as much as you can to save the tooth. Now, that's when the dentist will suggest a root canal. And a lot of us have apprehensions about doing a root canal. Now, at this stage, if we do a root canal, we can get our tooth saved. But please try and understand that a root canal can be avoided with a simple dental checkup, getting yourselves filled. Moreover, if you do not have any caries, you are the right candidate for prevention. There are basically different protocols available to prevent dental caries. Now, what are they? There are topical fluoride applications, there are Pitt and Fisher applications. Now, these are all done by a dentist professionally. So, I would suggest that you visit the dentist and take an opinion. What best suits you, the dentist will be able to guide. This fluoride and Pitt and Fisher sealant will basically block the food from getting stuck onto the tooth surface and alter the nature of the oral bacterial flora. Now, the second commonest problem that we encounter is bleeding gums. A lot of us, when we brush the teeth or when we eat something, we feel that we bleed in certain areas. Why do we bleed in certain areas? Because we have not brushed our teeth sufficiently. Now, when we have not brushed our teeth sufficiently, a lot of food gets accumulated between the gum and the tooth surface, and they sort of calcify. Calcify meaning they harden. Now, once it is hardened, it is going to impact your gums and cause bleeding. Now, bleeding with little itself, you can go and get it treated. Go to a dentist, get yourselves cleaned. We call it as the oral prophylaxis procedure. It's a simple procedure. During the lockdown, a lot of us would have experienced tooth pain in some form or the other, and we could have also had a difficulty in accessing a dentist. In the city, it could have not been a major problem, but in the rural areas, it definitely was a problem. Even a tooth pain, there was not a single dentist available to address it. Now, why? Why did the tooth pain, or why did we experience a sort of a discomfort? The reason being, we are not maintaining our oral hygiene. All of us will be knowing that, we have to brush twice daily, but is brushing twice daily enough? Brushing the right way will add more essence to maintaining the good oral hygiene. Now, how do we go about brushing right? A lot of us would be using strokes like this, either like this or like this. It isn't enough if we brush just like this. When we brush just like this, what happens is, over a period of time, whatever dirt is there in between your tooth, you are just displacing it. You are moving it back and forth, up and down, and leaving it right there. What perhaps we have to do is, we have to brush in sweeping motions. For the upper teeth, it has to be from top to bottom, and for the lower teeth, it has to be from bottom to top. It should be in sweeping motions, like how you exactly sweep your floor. Sweeping motions with vibratory back and forth strokes. We should take 3 teeth at a time, brush them enough sufficiently, and then move to the next round of teeth. So we start with the upper, we move from the upper to the lower, and then we move on to the inner areas as well. We should make sure that nothing has been stuck on the teeth. Anything that is stuck on the teeth seems to be the biggest enemy of the teeth. After we eat, we should make sure that we rinse our mouth. Rinsing with plain water is more than enough. A lot of us would be having the habit of using mouth rinses. A mouth rinse should not be used more than 3 weeks. If prolonged usage is there, then it will alter your oral bacterial flora. Please consult your doctor immediately if you are having a prolonged usage of the mouth rinse. During the lockdown, a lot of us would have had tooth pain, and we would have taken a lot of tablets. We would have called your local dentist nearby, who would have given you just the medication to take care of. Now, post lockdown, I would suggest that everybody please go and get yourself checked for your oral complaints and get them treated, because Dental issues are not going to settle unless they are treated. Taking tablets is not going to in any way settle your problem. Thank you very much. Have a great day. I thank the Inner Wheel Club of Madras Bay City for giving me this opportunity.